Hi, my name's Tom and I'm a doctor based out of the UK, and today we're going to be talking about benzodiazepines. They're a pretty common drug used here in the UK, so I thought it's pretty important that we go over it early on the channel. So firstly, let's look at some examples of benzodiazepines. Now this will vary from country to country, and each country will have its own preferences. And you'll often find that a variety of countries use different brand names, and you may have heard of things such as Xanax or other alternatives. However, the ones that we use most commonly here in the UK are diazepam, lorazepam, midazolam, and chlordiazepoxide. You can see that most of them end in am, which can be a way of identifying a benzodiazepine. However, there are going to be some exceptions, such as chlordiazepoxide. Okay, so next we're going to look at what they're principally used for. Now, they're often used for anxiety. However, it's important to know that this really should only be a short-term treatment for kind of severe and disabling anxiety. Obviously, because of the nature of benzodiazepines, they won't treat the underlying causes of anxiety, but can help with some of the manifestations of symptoms. They are often used for sedation, whether that be light sedation for procedures in A&E or for an adjunct to anaesthesia. They can also be used as a muscle relaxant, so we often use them for the management of seizures and status epilepticus. However, you can also use them for really nasty muscle cramps and spasms. And finally, the other common use of benzodiazepines are for alcohol withdrawal, and we'll go into that in a little bit more detail shortly. So with that in mind, let's look at how they actually work. So they bind to GABA A receptors found within the brain, and they work to enhance the effect of GABA. Now, GABA is the principal inhibitory neurotransmitter within the brain, and as a result, the cell becomes more resistant to depolarization. So this resistance to depolarization means that there are far fewer action potentials being generated within the brain, and this just results in a generalized calming effect on the brain. And that has the effects that we previously talked about, reducing anxiety, sedation, and muscle relaxation. Alright, so now let's have a little look about alcohol withdrawal. This is quite useful because it kind of explains why we get some of the withdrawal symptoms that we do with chronic benzodiazepine use. So with alcohol, or ethanol, it also binds to these GABA A receptors found in the brain. And that's why it has the same inhibitory and calming effect that benzodiazepines do. And in chronic use, the brain becomes tolerant to the constant stimulation of this GABA A receptor. However, if one day you decide to stop drinking alcohol, your brain is starved of the stimulation that it's been having for so long. And because you have a sudden switch from inhibition to excitatory state, you get all the nasty side effects that you do with alcohol withdrawal. And these are essentially all the reverse features that benzodiazepines have. The benefit of using benzodiazepines in this situation is we can replace the stimulation that alcohol has provided and slowly withdraw that in a much more controlled manner. So as with every drug, there are side effects, and let's look at them in a bit more detail here. So the first side effect that we have is dizziness. And this is relatively common, and it can just be that the individual is not used to such stimulation, and it can take just a bit of time for them to get over this. Secondly, we have confusion. Now this is especially prevalent in the elderly population, and often reduced doses are required. Reduced consciousness. So I guess this is one of those side effects that is sometimes desirable and is what we're going for when we're using obviously the drug for sedation. However, if you're using it for anxiety, this is obviously an undesirable side effect, and it's something that you definitely need to warn the patients about. The next side effect would be headaches, and this can be particularly prevalent when starting the medication for the first few times, but then people tend to adjust. Next, we've got cardiorespiratory depression. Now, because it has this suppressant effect on the nervous system, you get a degree of slowing of the breathing and the heart rate. However, this is far less profound than what you would expect with other medications such as opiates. You get slurred speech, so this kind of goes on with a reduced consciousness. You're just getting dampening down of that nervous system, and you can't quite form the words as effectively as you perhaps once could. A side effect that could potentially be fatal is a loss of airway reflexes. This is particularly common at higher doses and is definitely something that we need to be aware of, especially when you're elderly and frail. Because this drug is taken orally a lot of the times, as with every drug, it can cause a degree of gastrointestinal upset. And finally, the same with alcohol, it can cause a degree of dependence, and this can set in with just a few weeks worth of relatively regular benzodiazepine use. And that's why we definitely advocate this as a short-term treatment, and we really are not keen for patients to be on long-term benzodiazepine use. Okay, so let's now have a little look about toxicology and what happens in an overdose and what we do about that. So obviously an overdose can come in a variety of forms. We typically tend to think of your drug abuse individual that does it for recreation or perhaps is dependent on that drug. But often it can occur within the hospital patient, whether that be because they're old or frail, or because they've got other features that make them slightly more vulnerable to an overdose. Those other features include when taken with other CNS depressants, such as opiates, typically, we often see that in the hospital, or when there's severe renal impairment. It's worth noting that if you take benzodiazepines, whilst you've got quite severe underlying liver failure, it can precipitate hepatic encephalopathy, which can mean that it's increasingly difficult to interpret the symptoms and the signs that the patient is exhibiting. It's also worth noting that intra-arterial injection, such as in a falsely placed cannula, can result in severe limb ischemia, and this can have a superimposed infection, resulting in gangrene, resulting in a subsequent limb amputation. So next, let's move on to management, assuming that you've correctly diagnosed the patient that they've taken an overdose of benzodiazepine. So as with all critically unwell patients, an ABCDE approach has to be taken. Obviously taking a particular notice of airway in this instance, as we previously stated that a loss of airway reflexes is common in an overdose, especially at higher doses. You're going to monitor and manage all symptoms accordingly. So as previously stated, if there's a degree of respiratory depression and their saturations drop, you're going to apply oxygen. And if their respiratory rate drops below a satisfactory level, you might consider mechanical ventilation, albeit in the form of a bag valve mask at first. If there's a degree of cardiovascular suppression and their blood pressure was to drop, then you would manage that accordingly with IV fluids. At this point, you also do the appropriate tests and investigations. So it's worth getting an ECG, some blood tests, any of the other investigations that may be clinically relevant at the time. The benefit of gastric decontamination is currently uncertain. However, it's said that you can consider activated charcoal within 1 hour of overdose. However, if it's a staggered overdose, or if you're uncertain of the time of ingestion, then realistically it's going to make little effect. And it goes without stating that obviously this is only effective for benzodiazepines taken orally. Finally, we have flumazenil. Now, this is a specific antagonist of benzodiazepines. However, we rarely use this in clinical practice. And it's important to state this cannot just be used as a blind treatment for those that are, reduced GCS, drowsy, and you suspect that there may be benzodiazepine involvement. You've got to be fairly sure that it is purely benzodiazepines alone that have been used before giving this drug. The reason for this is because it lowers the seizure threshold. If you think about it logically, benzodiazepines are used to treat seizures. Now, if you reverse that, you're lowering the seizure threshold. Now, for example, if they are particularly prone to seizures, such as an epileptic patient, or if they've taken a recreational drug which predisposes to seizures, then you're in a really difficult situation, because the drug that you're going to use in the management of a seizure, you've just injected a specific antagonist against, so it's going to be far less effective. The other thing to note about flumazenil is it's got a half-life of just 1 hour, whereas often the benzodiazepines that have been ingested will have a longer half-life. So you've got to be careful not to get caught out when the half-life of the flumazenil wears off and you have a return of the symptoms. And it's important that you consider thinking of setting up an infusion just as you would for a naloxone, just so you can maintain the degree of reversal throughout. So that's all for today. Just a quick overview of benzodiazepines on a whole. I hope you've enjoyed it and I hope you've learned something. And if you have, please leave a like, comment and subscribe. I'm hoping to do lots more of these, and as you'll see, this is the first of many to come. I'll speak to you soon.